Having a shared mental model is essential for healthcare teams, including the patients and family caregivers that are part of them. When the meanings of messages are not shared, unnecessary confusion and stress can occur, as they did for this patient.
Hi, I'm Nikki Montgomery. I'm a patient advocate and a patient and family advisor. I came into this work because I have a child with a rare genetic condition and medical complexities. I learned how to advocate for my son, and I wanted to teach other families to do the same. My first encounter with my son's pulmonologist was not an easy one. He was kind of a gruff older guy, and he came into the room, looked at my son for a couple seconds, and said, "This kid's going to need a trach and a vent." To me, a trach and event meant that it was end of life care. So I thought he was telling me my 6-week-old baby was going to die. That was not his intention, but the miscommunication was very difficult. From that initial encounter with the doctor, I really heard very little of what he was talking about after that point in the appointment. But I did go home and talk to my sister, who had a disability and some experience with people with trachs and vents. And she's the one who told me that a trach and a ventilator did not mean end of life, and that people could survive for years, lifetimes, on a trach and a vent.
Checkbacks and teachbacks are useful tools to ensure message meanings are shared across the team.
In this encounter with the doctor, I assumed he was telling me one thing, and he assumed I had a different set of prior knowledge. And this is where a check back would have really come in handy. A check back is where a doctor will state something and give the patient an opportunity to reply back and show understanding of what that statement was. So if I had told him my understanding was that he was telling me my baby was going to die, he would have had an opportunity to correct that incorrect assumption right on the spot. So a check back really allows the patient to state what their communication needs are, what their understandings are, and get clarity. And it allows the doctor to provide more information as the patient is learning.
Effective communication sometimes takes time and experience to develop the trust needed between family caregivers and other team members.
Despite this tough beginning of our relationship, the relationship with the pulmonologist ended up being very rewarding for me. We were seeing him twice a week, and so we had lots of opportunities to communicate very candidly with one another, and for me to state my questions and him to answer my questions in clear ways that I understood. So this allowed me to grow as an advocate, and it allowed us to develop a trust with each other, where he would trust that I knew what was happening with my son's body and his daily care, and he would actually create a care plan that was based on what I brought to the situation. The ability to communicate clearly with one another really did build trust between me and the pulmonologist. And eventually we were able to have these very candid conversations and understand that we both had the greatest intent for my son's well-being in mind. That built our relationship over time, and it really made it a great working relationship where we both were taking part in the decision making for my son's care.
How can teams know which family caregivers they should be including in their discussions?
It's important for providers to remember that patients exist in a system, a family system, and a community. So it's okay to ask patients who helps to support their care at home and when they're out in the community. This is a great way to engage those care partners and actually have an opportunity to have conversations with them. That makes sure that the patients, their care team, and their care partners at home all have an opportunity to work together to make sure that the health of the patient is at the forefront and everyone has a chance to support the patient properly.
Team Steps tools exist to foster better communication in care teams, including communication with family caregivers and the patient. Other patient stories and the entire Team Steps curriculum are available on the AHRQ website